Good morning, everyone. We are back with our popular show, It's All in Your Head. And today, Dr. Swingle will be talking about something that everyone will benefit from knowing about. We are discussing maintaining cognitive health as we age. For those who don't know, Dr. Swingle was titular full professor of psychology at the University of Ottawa prior to moving to Vancouver. Fellow of the Canadian Psychological Association, Dr. Swingle was lecturer in psychiatry at Harvard Medical School, attending psychologist at McLean's Hospital in Boston, where he also was coordinator of the Clinical Psychophysiology Service. Dr. Swingle is registered psychologist in British Columbia, certified in Biofeedback and Neuro Therapy. His newest book, Biofeedback for the Brain, was published by Rutgers University Press, and the book is available at soundhealthproducts.com. We welcome you to send us your questions at any time during this webcast. You can do so through the chat feature, which is located on the control panel on your right. We'll have 2 breaks to answer your questions. Okay, I think we are ready to get started, and here is Dr. Swingle. Good morning.
Good morning. So today we're going to be talking about age-related declines, and better yet, we're going to be talking about how to prevent them, and brain brightening, and some issues associated with cognitive inefficiencies. Now, there are some benefits of getting older, and I notice from the list of folks listening that some of you are in my age range. So we can all gloat here for a few moments. As we get older, we get wiser. And this is a well-established fact, by the way. This is just not my trying to be defensive about my age. Pattern recognition is the reason. So even if our brain becomes somewhat slower, nonetheless, we have what Eckhart has called wisdom, and that is based on we've seen it all before. There's another issue associated with this, and that's quiescence. That is, if we're able to embrace the fact that we are wiser, then we become more quiet, that is, more at peace with ourselves. And we've seen it all before, and the old New York phase, forget about it. That we've seen these things before, and we know how things are likely to play out. And don't forget the benefits of failing memory. The older we get, the better we were. Okay, let's get started here. The Einstein Phenomenon. We have a lot of folks come into the clinic and say, I'm failing. That is older folks. I don't remember as well as I used to. My brain isn't as efficient and so forth. And folks around them are not aware of that. And we refer to this as the Einstein Phenomenon. If Albert Einstein walked in the door and lost 10% of his cognitive functioning, no one around him would be aware of it, but he would. And basically that's what we are dealing with in a lot of these kinds of situations in which a person is cognizant of the fact that there's some declines taking place, even though they're able to function perfectly adequately, and they see, and other folks around them don't see it, they see it, and that's a very good time to take corrective action. And there are a couple of factors that we're going to be talking about with regard to age-related decline, and the big one is activity. Certainly there are genetic predispositions, certainly our life experiences affect this, certainly disease affects this, but the thing that we have control over, absolute control over, is activity. And as you'll see as we go through some of the research on this, activity is critical. The recipe for cognitive decline: sit on the sofa and eat lots of potato chips and watch more than 7 hours of television. Okay? That is a perfect formula for really accelerating age-related decline, and there's a lot of research about this. This is simply a study that was reported in the Neurobiology of Aging last year, in which they simply looked at older individuals and looked at the intake of sodium and physical activity, and saw very decided effects of increased salt and decreased activity. Activity, action, movement, motion, bustle, hullabaloo, commotion, doings, and goings on. In other words, get off the sofa. Now, some interesting research. Walking speed and dementia. Now, what they did is have a look at folks, average age 77 years, and these were people that were coming to the memory clinic. And they simply looked at walking speed, and what they found was groups walking speed was an indicator of the predisposition to cognitive decline, and it was quite clear. The other thing that they found is the notion that if you are engaged in some other activity, it affects gait. My grandmother used to say, you're really smart if you can whistle and chew gum at the same time. Okay, well, this is this sort of thing. And I'm going to be hammering away at this. Here we have some more examples of this. Decline in cognition is preceded by changes in the brain. Now, the second thing that we find is that if you have individuals in walking situations, that is, individuals that are active, and walking was the measure and the activity, they had a 2% increase in the hippocampal size, as opposed to a 1.5% decrease in individuals that had a controlled movement situation. So it's perfectly obvious. Get out and walking is what you want to do. This was recently reported at the Alzheimer's conference in July of this year. So what we do at the clinic is we give folks a simple pedometer, which is a biofeedback device, and it gives you a rating of how many steps you've taken during the day. You can convert it to kilometers and miles and so forth and so on, but what we use is just number of steps. An active individual does 10,000 steps a day. Most of the folks that come in and report, complain about cognitive decline are well under 5,000. So this is a very simple method. Put it on in the morning and keep a log of how many steps you're taking during the day, and just have planned activities that gradually increase your activity level. A lot of individuals will tell people, stand up straight. Now, why are they doing that? Well, Eric Pepper has done a lot of research in terms of how activity levels affect things like depression and cognitive processing and so forth. And here's just a simple study that he did. Having students walk either heads up, looking ahead of them, or slouching, that is, looking down at their feet. And what he found was that in terms of their ratings of energy levels, individuals who rated themselves in the top and bottom 20% of self-rating of depression, individuals that engaged in a slouched walk were much more likely to rate their energy levels as decreased. So when you see an individual walking down the street, shoulders back, head up, there's a reason for that. The activity level and the posture in which the activity is taking place are critical in terms of maintaining good cognitive health. Okay, that's the activity level. Now, cognitive exercises. Read. And this is work that was done, let's see, I believe it was, Mayo Clinic. indicated that individuals who read books, played games, participated in crafts and so forth, there was a 30 to 50% decreased risk of developing mild cognitive impairment. Now that's huge in terms of what we can do in terms of keeping ourselves alert and healthy. They had a number of these studies, and the Mayo Clinic had a lot of these things. This was reported in 2009 at the neurology meetings in Seattle. And the other thing here that's critical is sitting and watching TV. It's bad for kids, and it's bad for people our age. My age, I should say, not ours. 7 hours is huge, and all they did was break at the 7-hour point. Individuals who watched less than 7 hours of television a day were 50% less likely to develop mild cognitive impairment. Okay? Very simple and straightforward. So engaging in cognitive activities and socially active individuals, social activity was important as well. Now, there's nothing new about this. I mean, we all knew about this. We were always telling people, get off the couch, get out and walk, read, chat with your friends, and turn the boob tube off. Now, this is one of the harmonics that we use at our clinic, and this is a sound that people play in the background when they're reading. And the reason for this, we use it for both kids that have attention deficit disorders, learning disorders, and we also use it for the elderly, folks my age, in which what they do is they play this sound softly in the background while they're reading. Now, what you're looking at here is a distribution of the amplitude, that is the strength of brain waves in the 3 to 20 cycle a second range. From 3 to 7 is theta activity, and theta activity is associated with hypoactivity of the brain. It's a resting state in the brain. Then you have alpha. Now, alpha, we're going to say a lot about alpha. What happens as we get older and what's associated with age-related decline is a decrease in the speed of alpha. That is, you're going to have more slow frequency alpha, that is the intensity amplitude of the slow frequencies, that's 8 to 9 cycles a second, is going to be greater than the intensity amplitude of the faster alpha, that is 11 to 12. And this is what that harmonic tape does. So we get a suppression. You can see the percent change. It's a decrease in the strength of the slow frequencies. And the really good news is a major increase in the strength or amplitude of fast alpha. Okay, which is exactly what we want to prevent and mitigate age-related declines. You get some increase in the faster frequencies as well. Okay. This is another device we use at the clinic for increasing cognitive efficiency. These are glasses in which there's clear lenses here, so you can look right through them. And there are lights on the periphery of the glasses. And now there are 3 programs in these. One is a constant light like this. So for seasonal affective disorder, you just put it on, turn it on, and essentially you're carrying your light box around with you. So you put it on before you get out of bed so that they are on early in the morning. And you can look right through them, so you can be getting dressed and eating breakfast and so forth and so on, while you are exposing yourself to the added light that we need, particularly at this time of year. Now, a second program in here is when the lights are flashing, and they're flashing at a frequency to increase fast alpha. And we will often have individuals do this for a few minutes a day while they're reading. It has a similar effect to the harmonic sound that I was just discussing earlier. And anybody who says, well, I'm too old to start that, nonsense. Put that idea to bed. These are folks older than 75 years of age, okay? And this was just recently reported in the British Medical Journal. If you smoke, stop. I don't care how old you are. Physical activity, such as walking, those participants who regularly engage in these activities had a median age at death 2 years older than participants who did not engage in these activities, like walking. And one or more leisure activities and a good social network adds a lot to longevity, okay? So we can decrease age-related mental declines. We can increase longevity, and we can increase mood-related conditions, okay? And it's all in your control. Now, after we have some questions and announcements, then we're going to go into some of the issues associated with how neurofeedback and neurotherapy can assist in these situations.
Yes, we have few questions here. Dr. Swingle, what is the harmonic that increased alpha as shown earlier in this webinar, please?
What is it? It's Omni, O-M-N-I. By the way, that research, that slide was sent to me by the late Dr. Budzinski. He had a look at some of the early harmonics that I was using, and this is one of the ones he sent me. It varies from person to person.
Okay. You comment on walking being good for old people. I can't get around without a walker or wheelchair. Is there something I can do other than walking which I cannot do?
Yes. Resistance exercises. There's some interesting research on that as well. And what resistance exercises are essentially pick up weights. So you can do upper body movements, curls and so forth with weights. And also, if you have a walker, of course, you can establish a routine of walking up and down a hallway, for example, things of that nature. So there are a lot of things that you can do. And I would consult with a trainer, somebody in particular, a physiotherapist who has some experience with working with elderly and individuals who have movement restrictions in terms of what kind of exercises would be useful for you.
I have a David Pal audio-visual system. Does that provide the necessary lights to treat SAD?
David, the David, yes, the David series of AVS systems do have adequate protocols. What you want is something that's fast, by the way, something 11 cycles a second or higher.
Okay. Was there a third option for the eyeglasses, the spectra you spoke about?
Yes. There's one that is for balancing the front part of the brain. We use that a lot with folks that have emotional trauma situations or thoughts that are intrusive.
When you treat memory and forgetting problems with seniors, how long do the improvements last?
If we're dealing with something like the first thing that we do is do a brain assessment to see what's going on. So if you have a predisposition to depression, for example, we take care of that first. That is, we get the foundation firm. Now, correcting a neurological or a genetic predisposition for depression, once we correct it, it tends to stay corrected. Age-related declines are a different issue. they're not stable. So once we bring it up to where we want it, then we give you some things to use at home. And it's just like going to a gym doing physical exercise. You're doing mental exercises to maintain a good cognitive health. That is, to maintain the brainwave amplitudes where we want them. And typically people my age, in the 75-year-old range, come in 2 or 3 times a year to maintain the gains.
Okay, and we'll take one last question. We will have another break later on, so if you have more questions, just keep them coming. How do you do your brain assessment?
A brain assessment is an electroencephalograph in which we measure 5 critical areas in the brain. So basically we're looking at brainwave activity when your eyes are open, eyes closed, and reading something, so that we get an idea of how the brain is functioning at rest with your eyes closed, and then under what we call cognitive challenge, that is when you're processing information. Typically, we do not ask why you've come to see us. The brain assessments that we do are so precise we can tell you why you're here. That's particularly true for things like mood disorders, anxiety conditions, sleep disorders, and so forth.
Okay. I know I said this is going to be the last question, but since we talked about the Omni, I'll just get one more and then we'll move on. I get sleepy every time I read. Will using the Omni harmonic in the background help with this?
Usually it does. Now, if you get tired when you read, there's a particular process that's taking place in brain activity. Typically what's happening there is your slow frequencies are increasing under cognitive challenge. Now, in young children, an exaggerated form of that is a form of ADD, in which the brain looks absolutely fine at rest, but when you get the child to do something like read, the slow frequencies come up where they should be going the other way. And that's a particularly pernicious form of ADD, because the harder the child tries, the worse it gets. When we see this in less extreme forms in folks my age, this is why we get tired. We read and we fall asleep. So we tend not to read enough. And the answer to your question is yes, the harmonic will help a lot if that's the issue of increased slow frequency. You'll find it'll make a profound difference.
Okay, thank you, Dr. Singhal. Like I said, we'll take more questions during our second break.
Okay, so neurological conditions that can slow brain efficiency. The question that we had during the break asked about how do we do our measurements, and these are the sites that we measure when we're doing the brain assessment. We're looking at the frontal cortex. F3 is the left, F4 is the right. We're looking at the midline, FZ, and there are very important structures right under that site. We look at an area right over the sensory-motor cortex, CZ, and then the back of the brain associated with quieting, sleep, and so forth. This is the actual data from one of those assessments, and this is a client, 77 years of age, and what I just want to show you here is how much we can learn from just doing 5 sites, 6.5 minutes of recording time. The first thing I know, now 01, if you remember, 01 is right here. At 01, this individual has a relationship of the strength of theta, 3 to 7 cycles a second, to the strength of beta, 16 to 25 cycles a second, of 1.17. We want that up around 1.7, 1.8, something of that nature. So it's low eyes open, but it's very low eyes closed. This is the marker for sleep disturbance. The hit rate on this predictor of sleep disturbance is almost 100%. So I know that this individual has a sleep problem, and sleep problems as we get older is an extremely serious problem. It gives rise to all kinds of accelerating age-related declines. The second thing is I'm looking at beta here. Now, beta are brain waves from 16 to 25 cycles a second, and we're looking at the F4, F3. F4 is the right, F3 is the left, and what we're looking at here is the difference between those two. And we can see that the right side is 60% more active, that is 60% greater amplitude in the right side of the brain relative to the left. That's a marker for predisposition to depressed mood states. So I know this person is prone to depression, probably experiences depression. It was probably the reason that the person came in for treatment in the first place. Now, here's the age-related decline variable, and this is the ratio of slow alpha, 8 to 9 cycles a second, relative to fast alpha, 11 to 12. Now, you remember the slide from Dr. Budzinski. What Omni does is it decreases the amplitude of that slow frequency and increases the amplitude of the fast frequency. So there's a simple home treatment procedure that can help a lot to mitigate this. Now, her ratio is 2.88. We want it below about 1.5. And where this is measured is right there, although it's relevant all over the brain. Okay, so this individual has a sleep problem, depression, and the age-related decline is accelerating. Is when the right side of the brain is more active than the left, and there are lots of ways this can happen, that's a marker for depression. Now, it may be a predisposition or it may be a current state. We also know that the individual is experiencing a sleep disorder, and the way we measure that is in terms of the relationship of fast to slow activity in the back of the brain. This is the area associated with quieting. So good stress tolerance, good quality sleep, and so forth are implicated in this area. And we measure the activity of the slow-fast alpha. We're measuring up in this region, right in the mid-line area between the two frontal cortex areas. Now, everybody want to see a work of art? This is the alpha response on a healthy brain. Now, the first thing is this person has their eyes open. And what you want to see is that you want to see an inverse relationship between the frequency and amplitude. That is, lower frequencies should have higher amplitudes, high frequencies should have lower amplitudes. Now, I've asked the person to close their eyes and see this big jump in alpha. And that's exactly what you want to see. And when they open their eyes, it should drop like a rock. And they're going to open their eyes just in a few moments here. There it is. So there's a nice, healthy work of art. That's a brain that's functioning the way a brain should function. And we have other ways of looking at this. This is an eyes open topograph. And watch, here's alpha. So just look at the back of the brain here, and here comes eyes closed. Okay, that's what should happen. It should light up. So alpha increases substantially when you close your eyes, and when you open your eyes, bam. Okay, it should be very efficient. So that's your second marker of efficiency, brain efficiency. Now, we can measure this in terms of just looking at the percentages associated with how fast the person returns. So we have a printout of this when we do the brain assessment. And here you can see it takes, this is the amount, how fast the alpha returns to base level. And we want it as close to 0 as possible. Anything above about 25% is indicative of slow alpha return. Here's the back of the brain. Again, we want it below 25% or so. So it takes this person a long time to go from one state to another state. And this is what the complaint was, foggy thinking. This is what it should look like. Okay, brainwaves moving along. I tell the person to close their eyes. It should come up very rapidly. We have high alpha, and then I ask them to open their eyes. It should drop like a rock. That's what it should look like. Now, here's drug-induced alpha slowing. 70-year-old woman. We saw her earlier, and her low-high alpha was very high. Okay. So we did some treatments, brought it down, and cut it in half. She then had surgeries, and the surgeries involved full anesthetics. Anesthetics are very, very problematic for the elderly and the young. We know that a single full anesthetic of a young infant will have cognitive implications, can have serious cognitive implications, and that's certainly true with the elderly. Now look what happens after that full anesthetic, and they also put her on oxycodone, which is a pain medication that has many of you are familiar with some of the problems with this stuff. So you can see what happens, and then we did some neurotherapy to bring it down, and we brought it down again to about half of what it was when it was again made problematic by the full anesthetics and the pain medications. Okay, depression. Depression is extremely serious with folks my age. It deprives, the principal issue with depression, from my perspective, from the neurological perspective, is not necessarily the sadness. What is particularly problematic is it deprives us of motivation. So we oversleep, we sit on the couch, sometimes we get into the bottle, and it's an extremely serious problem. This is what depression looks like. Now, there are many, 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 many ways that we can have imbalances in the front part of the brain that give rise to depression. This is a situation in which there's elevated slow frequency in the left, which means that area of the brain is hypoactive, meaning that the right side is more active than the left, and that's the marker for predisposition to depression. So the previous case that we looked at, the left had elevated beta, meaning that it was more active than the right. In this case, the left has, elevated theta, which means it's hypoactive, so the right is more active than the left. And as we saw in the previous slide, this is what depression looks like when we're talking about elevated beta in the front. F4 has 58.6% greater strength of beta in the right relative to the left. So this is the culprit in terms of depression, when this side is more active than that. And as I said, there are lots of ways that can happen. Of course, if you work for the government, you're at very great risk. So individuals who work for the government, this is data coming from England, of more than 11 hours a day were twice as likely to become depressed as those who work a mere 7 to 8 hours a day for the government. Okay. Anxiety. The typical anxiety marker is when the back of the brain has too much fast activity. Now, here we have the ratio of the strength of slow frequency, 3 to 7 cycles a second, divided by the strength of the fast frequencies, 16 to 25 cycles a second. We want twice as much theta as beta in terms of amplitude. So here's your marker for anxiety. When you have a deficiency of the theta-beta ratio, you have poor stress tolerance, predisposition to anxiety, often self-medicating behavior, often sleep quality problems, and fatigue. And here it is right here. This is what it looks like on a topograph. The nose is up there. This is the back of the brain. And here we have elevated fast frequency amplitude sitting right there. That's what it looks like. And it's all sitting right back in this region. Now, we often think of deficiencies of attention as being a situation associated with young children, but folks my age can have attention deficit disorder. And this is what it looks like. And this is marked elevation of slow frequency amplitude in the delta and theta range. So there's too much slow frequency, meaning the brain is hypoactive. There's another form of an attention problem, and that's high frontal alpha. And here's the alpha intensity. And alpha is between 8 and 12 cycles a second. Now remember what we said before. We want to see the highest amplitude with slow frequency, the lowest amplitude with fast frequency. So here we have a blip. We have low amplitude, then high amplitude for alpha, and then it drops back down again. So the problem here is there's the strength of alpha is much greater than what it should be. And here's the ratio that we look at. Now, what this is associated with is poor ability to sustain focus and attention, poor ability to plan, organize, and sequence. In young children, it's a very problematic form of ADD. And it's also problematic in the elderly. And it sits up in this region again, too much alpha activity. Alpha is a parking frequency in the brain, so the brain's parking too much.
Okay, more questions. I can't sleep and the sleep medications make me so foggy and dizzy that I rarely can take them. Is there anything I can do to help sleep?
Absolutely. The problem with sleep medication is you don't get good quality sleep. And secondarily, you usually get hangovers from it, which is what you're reporting. And the first thing that we do is we do a brain assessment and see what the brain looks like. Do you have the marker for sleep quality issue? The second thing we do, and I'll be talking about this a little later in this talk, do sleep assessments so we know exactly what's going on in terms of the architecture of the sleep. Then we have a number of things that you can use. You can use sleep harmonics. It's the reverse of the omniharmonic that I was describing earlier. That is, it increases slow frequency. It is a sleep aid. We also recommend the use of cranial electrical stimulators, CES units, and there are a lot of them available. Excuse me, we have one that we offer through Sound Health. They're FDA compliant and registered and approved for sleep problems, anxiety problems, and depression. And they're devices that you can give yourself treatments at home. First order of business is find out what the brain is doing, however.
Okay. My mother-in-law is taking huge amounts of medications and still she's always worrying and forgetting things. I think she would be much better off the medications. What do you think?
Absolutely. The number of medications appropriate for an adult my age is 0. Now, we have to be realistic, of course, and the reason we use medications is to get a person from place A to place B. So they may need an antidepressant for a short period of time, but the bottom line, of course, is to get the brain functioning properly, get the individual active, get the individual cognitively engaged, and get the individually socially engaged. Those are that's the prescription for good cognitive and physical health. Getting an elderly person off medications is a very tricky matter. Now, I worked with some of the best psychopharmacologists on the planet when I was over at Harvard Medical School. It is a real knack to be able to take an individual and do the pharmaceutical mixes that are necessary, and then once the individual is functioning well with the other kinds of programs that are necessary, then you gradually titrate them down, and you titrate off one medication, then another medication. Sometimes you substitute one medication for another to facilitate the titration.
Do you think sleep apnea is a condition that neurofeedback can affect?
Sleep apnea is usually not the only issue, but the answer is you do get some benefit from neurotherapy with conditions like apnea. However, apnea is very often a physical thing in terms of the airway closures. So there are things like always sleeping on your side, never sleep on your back, the mouth extenders that where they push out the lower part of the jaw can be very helpful, and weight, of course, is a big issue.
I have heard many people say that the elderly should keep working and not retire. Is that true?
You bet. I had some surgery done recently, and I said to the surgeon asked me, he said, "You're still working, of course?" And I said, "Yes." He said, "You intend to continue?" And I said, "I'm a believer in Freedom 95. And the surgeon looked at me and said, "I'm a believer in freedom underground." So the answer to your question is, don't quit. I treated a huge number of people when I was in Ottawa for very serious depressions and age-related declines and so forth. And overwhelmingly, this population were individuals who worked for the government and didn't like what they did and retired out of something rather than into something. And as soon as they retired and sat down on the couch, the lights went out in 18 months, okay? And that can be either in reality, that is, they died in 18 months, or they had a metaphorical death in the sense that the lights went out. So I'm a great, great believer in physical, mental activity. Now, if you love your work, no reason to quit. But find something that really is engaging. Start a business.
Thank you, Dr. Finger. We'll have to move on.
Okay.
That is just before you go. I just got a comment here. I listened to the news today and heard that there is a 99-year-old teacher who still works. I loved it.
Good.
There you go.
Okay, poor sleep quality. This is a big, 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 big issue. What we do is we send you home with a wireless device. This is a device you strap on your head, and it monitors sleep activity all night. And we do a 4, 5, 6 day recording, so it's not like the 4-hour picture that you get in these sleep labs when you go and sleep in a strange environment for 4 or 5 hours. Excuse me. This gives us the sleep pattern over the entire night in your own environment and for 4 or 5 days so that we know that it's stable, so we know what it actually looks like. And this is the printout that we get. And in this particular case, what we're looking at here is, here's deep wave sleep. Now, deep wave sleep is extremely important for recovery of the body. That is, that's where all of the healing and recovery takes place for your physical body. REM, on the other hand, is mental. That's where you do all your own psychotherapy and where you integrate all of the things that you've learned. So this is all the cognitive stuff that's taking place. You need about an hour of deep wave, and you need about 2 hours of REM. So here we know instantly what the problem is with this person. This person is seriously REM deprived. That's the only REM that this person had. Had 19 minutes of REM. Here's another picture of an individual, and look at the waking. Okay, so here's what this problem is. And it's not only the amount of time you're awake, but see the pattern? It keeps breaking up the sleep. So this person didn't have any deep wave sleep, nor any REM sleep after, 3 o'clock in the morning, okay? Just a lot of waking. Okay, so this is the same person, of course, very REM deprived, and many too many wakings. Sleep architecture. Now, this is what we were just talking about. It's not just a matter of hours in bed. Big mistake that we make. A very, very efficient sleep pattern may be somebody who's sleeping 6.5 hours. They have an hour of deep. They have 2 hours of REM, and they have minimal wakings. Okay, that person's going to be very efficient. Now, the most damaging effects of sleep deprivation are from inadequate deep wave sleep. Deep wave is extremely essential for the body repairing itself and build up energy. It has a major role in health and stimulating growth and development, repairing muscle tissues, boosting the immune system. REM sleep renews the mind. This is what plays a part in learning and memory. You integrate all of the stuff that you've learned during the day, and you do your own psychotherapy. That, in my judgment, I think that's really one of the main functions that, why we developed REM sleep. Stay out of offices like mine. Get yourself 2 hours of REM, you save on psychologists. But there's a changing view of sleep disturbance. We always used to think of sleep disturbance as a symptom. The person is depressed, therefore they can't sleep. The person is anxious, therefore they can't sleep. I think it's very useful to look at this the other way around, that sleep disturbance is a disorder. It's a disease, if you want to use that metaphor, and it's the cause, not the symptom. And to have a good idea of what the sleep architecture looks like, and then relate that to brainwave activity, we have an extremely efficient way of dealing with problems of sleep. Okay, neurotherapy. There are two principal forms of neurotherapy. One is neurofeedback. That's the one most people are familiar with. We set it up so that when the brain is doing what we want it to do, you'll hear a tone or see something move on the screen, and you learn how to self-regulate. Brain driving is a more aggressive form of neurotherapy, and it uses what we call classical conditioning as opposed to instrumental conditioning, which is what neurofeedback is. In brain driving, what we do is we measure a particular aspect of brain functioning, Based on that measurement, we stimulate with light, sound, microamperage stimulation, EMF fields, and so forth to nudge the brain into more functional areas. So this is the setup for neurofeedback. We put wires on the ear. One is a ground and one is a reference, and then we put a wire at the area that we want to treat on the brain. And this is a feedback that we use for kids. So when the brain's doing what we want it to do, the icons move. And we have all kinds of games that the kids can play. You know, they can play Pac-Man and so on. And we let adults do it too, of course. And when the brain's not doing what we want it to do, stops. Does what we want it to do, moves. Not doing what we want it to do, stops. Okay? And for adults, a lot of folks like to see the actual waveform, so we have thermometers over here that tells us the strength of the brain wave that we're working with and gives the actual raw signals. And this is the distribution that I showed you earlier. A lot of folks like all of that feedback, and they use that for controlling their brainwave activity. Brain driving. Here we have a situation in which we're presenting sound, we're presenting lights, and we're stimulating acupuncture points. Now, all of this is driven by the brain. So when the brain is doing a certain thing, we may turn sound on. When the brain is not doing a certain thing, we may stimulate an acupuncture point. And we're constantly presenting and eliminating what called unconditioned stimuli to keep pushing the brain in more functional areas. Now, we give controls very often to the person, so they're controlling the intensity of the sound and the intensity of the lights, so that they set it at a comfortable level for themselves, so they're not startled by it, for example. Now, this is at the beginning of treatment, and there's the end of treatment. So we have a new way of restoring about 30 years to your life. I'm joking, of course. And these are the brain drivers here, so that we can present the sound, we can present lights, and we do the electrical acupuncture here. Okay, same setup that we had for the other woman. Okay, here's what brain driving can do. The back of the brain. And what we're concerned with is that ratio of slow to fast activity. You remember that in the back of the brain, we want the ratio of slow frequency, theta, to high frequency, beta, to be in the range of roughly 2. This person started at 1.38. In fact, before we started the treatment, it was 105, and then it went to 138 within the first 3 epochs. And it was 2.22 at the end. So that's an increase of about 60%. That's what you can do with brain driving. It's a very aggressive, very efficient way of moving brainwave activity. You recall that the ratio of slow-fast alpha is one of the principal issues associated with age-related declines. We want the ratio of slow-to-fast alpha to be below 1.5. And here the individual started at about 2.8, and after treatment, it was substantially reduced. The person's not finished yet, and it won't stay there because we've been pushing it now. It'll increase a bit after treatment, but it will not go back to where it was. So it's a very efficient form of neurotherapy. And here's a rapid response to brain driving. This is an individual who had treatment, brought the the low-high alpha ratio into an acceptable range, and hadn't had treatment for a while, and came back, and it had gone, the ratio had increased to an unacceptable level, and he responded, "This is a 20-minute session." So we were able to restore it to where it was very, very rapidly. The final thing we want to keep in mind is that traumatic brain injury may be an issue. If you look at the characteristics of mild traumatic brain injury, we have difficulty concentrating, difficulty with attention, fatigue, anxiety, depression, sleep disturbances, personality or mood changes, and so forth. And a lot of people are not aware of the fact that they have a brain injury. Now, brain injury is cumulative, so you may have had a few knocks on the head that you recall, but nothing seemed to be of any importance. And then you take a fall and hit your head, and it doesn't seem to be very major, but you have these very serious potential symptoms associated with it. So it's something we want to check for. And here is what happens with untreated traumatic brain injury. This is the ratio of slow to fast activity. So, what he's looking at here is peak frequency. How fast is the alpha? So it's 11. It's up in an acceptable area. Had the brain injury. 2 years later, it's down to 9.5. A year after that, it's 0.85. It's 8.5. Okay, so this is what happens with untreated traumatic, or can happen, I should say, with untreated traumatic brain injury. This is from Dr. Gluck, who has his practice in Florida. Okay.
All right. This is the book I mentioned at the beginning of the webcast, Biofeedback for the Brain, written by Dr. Swingle and published by Rutgers University Press. If you would like to read about neurotherapy, this book covers it all, and it can be ordered at soundhealthproducts.com. This is another book written by Dr. Swingle, Basic Neurotherapy, the Clinician's Guide, and this is a useful guide for clinicians who want to introduce basic neurotherapy procedures into their practices. It can be also ordered at soundhealthproducts.com. Swingle Clinic provides many educational activities like public lectures and webcasts for general public and grand round sessions and workshops for professionals. The association that we cooperate with, Biofeedback Foundation of Europe, also provides Dr. Swingle's courses and webinars. You can visit www.bfe.org for more information. We will have actually this year it's going to be our third fundamental neurotherapy workshop. It'll be from October 19th to 21, so it's this coming weekend. We only have 2 spots remaining, so if you are interested, you can send me email at rita@swingleclinic.com. And the following week, we are going to have our advanced workshop, so that will be from October 26th to 28th. If you have any questions, again, you can email me at rita@swingleclinic.com. And this concludes our webcast. We hope you enjoyed it, and we will be back on November 17th with Mari Swingle, who will be talking about the influence that media and technology have on mental health. I'm looking forward to that one. Until then, have a good one, everyone. Bye-bye. Thank you, Dr. Swingle.
Thank you.